Hello, everyone. This is Milena from the Becker's Healthcare team. Thanks so much for joining us today for our webinar, Humanizing Healthcare, How Innovation and Compassion Can Help Medicare Advantage Members Thrive at Home. Before I introduce our speakers and we begin, I have just a couple quick housekeeping notes to walk us through. First, you can submit any questions you have throughout today's webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded, so we'll have this webinar available to view on demand following this event. You can use the same link that you used to join today to access the recording at any time on demand. And if at any time during our webinar while we're talking, if you have any issues with your audio or visuals, we suggest just refreshing your browser. Again, you can submit technical questions as well into the Q&A box on your screen, and I'll be keeping an eye on those and happy to help troubleshoot. With that, I think we will go ahead and get started. I'm excited to introduce our two speakers today. We have Rona Lee, Corporate Development Officer at Scan Health Plan, and Dr. Ben Zaniello, Chief Product and Medical Officer with Best Buy Health. Thank you, Rona and Dr. Zaniello, so much for being here with us today. I will turn the floor over to you to get us started.
Awesome. Thank you. Howdy, everyone. We thought we'd start with very quick intros. Again, I'm from Best Buy. Generally, the first question that the audience will pop in is, are we going to talk about kind of TVs and installation? And do we, in fact, do that in the health plan space? The short answer is maybe, but that is not the part of Best Buy that we're going to talk about. We're going to talk about our health division, which beyond being one of the largest retailer of health devices, think blood pressure cuffs and smart watches and rings, we actually are a substantive player in the fall detection space and supporting the aging population and aging at home safely and independently. That's the real level of detail I'm going to go in. Instead, I'm going to really focus on what we do with health plan membership. And I'm actually going to first let Rona introduce herself, and then we can talk a little bit about what we're seeing in the market today.
Thank you, Ben, and thank you everyone for joining us. As you mentioned, I am Rona. I'm the Chief Corporate Development Officer here at Scan Health Plan. My role centers really around driving strategic partnerships, investments, and care delivery innovation to advance our mission, which is pretty simple, keeping seniors healthy and independent. For those of you who don't know Scan, we were founded by senior activists who were determined to improve access to care. Today, we're a leader in Medicare Advantage and serve over 300,000 lives in 5 states, going on 6. So California, Nevada, Texas, New Mexico, Arizona, and we're rapidly expanding our footprint across the nation by forming deep provider partnerships. Everything we do really is anchored on the basis of empowering seniors to thrive at home, whether it's through personalized care models, leveraging technology, or building deep partnerships with the providers and community organizations that they trust.
Awesome. Since you mentioned it, I think we should plunge right in and talk a little bit about Medicare Advantage, not simply because of this really exciting open enrollment period, which of course happens every year, but the kind of bigger question about Medicare Advantage and the landscape we're seeing with this current administration. So can you talk a little bit about what's happening now? Probably most of the people involved are aware of it, but love to hear your thoughts.
Yeah, I mean, that is a loaded question, but maybe let's take a step back to understand the backdrop. We're going through AEP now for 2026 enrollment, but remember that these plan products were designed and submitted in the first half of 2025, meaning that a lot of these strategies were really shaped by what carriers experienced all the way, and 2024 was pretty rough. So now agents are starting to notice something different this year. And if you're a senior and you're looking at your advertisements, you're probably being advised to look for something different as well. There are some areas where entire plans have just disappeared, not just one or two, but entire names gone at scale. Zero premium dollar plans suddenly have premiums with maybe a zero extra than you had expected previously. Deductibles have popped up where they didn't exist before. Benefits are getting slashed. And I think all in all, major carriers have pulled back from at least 100 counties. And so as a result, that means that seniors in the space are being forced to shop rather than stay put and really consider what's next for their care. It's interesting because CMS actually projects a decrease in MA enrollment for 2026 based on carrier bids, but we don't think that members are leaving MA. We think that they're going to be shopping within it, and we're certainly seeing some exciting growth on our end, so stay tuned there. But we're really thinking that the winners in this market dynamic will need to be focused on product sustainability, both geographically and in product design, and delivering strong member experience.
What do you mean by sustainability? What does that mean? I think everything you said totally resonates, that there's probably an opportunity to expand, and certainly by the numbers you all seem to.
Mhm.
Why do you think that is?
Yeah, I mean, sustainability for us means, we need to be reliable for the seniors that we serve. We don't want to be here today, gone tomorrow. We understand how important it is for seniors when they make their plan decision that they're factoring a lot of other things in their aging journey. Whether they have children, whether they're at a certain, they're considering their finances when they're choosing their health plan. And we know that those are decisions that are not made lightly. And we have to consider the same amount of gravity when choosing the benefits that we're putting into our product. When we enter markets, it's with the promise that we're going to stay and not pull out when we've had a tough year. And I think that is a benefit of being a nonprofit that we maybe have a little bit less of the pressures to, need to react quite on the same cadence to be able to really stay put in the markets that we've committed to and make sure that seniors and the providers in the ecosystem have a good plan partner to continue working with to deliver Medicare Advantage.
Yeah, I think it's interesting. I mean, we purposely, as we kind of discussed what would be the most important thing for us to cover, and we even named
Yeah,
this humanizing healthcare. And I feel like that's, I mean, if we step back at the whole point of Medicare Advantage, it was moving from the Medicare fee for service, where everyone essentially is a set of devices, services, et cetera,
yeah,
that are worth a certain amount, and making it much more personalized, and
yeah.
that you'll have a relationship with a plan and with a provider. And while that's more narrow, that they'll know you. Can you talk a little bit about how you guys focus on that humanizing piece? Again, the
Yeah.
point of doing this?
At the end of the day, it's all about relationships, right? So let's just break down Medicare Advantage into the simplest thing. It's really not just about benefits on paper. If you really dissect into what you choose a plan for, you're looking for access to quality care. You're looking for networks that actually work and can service all of the different needs that you have. And it comes down to provider relationships, right? And so the provider relationships become really critical to making sure that we can manage our costs effectively while also making sure that the members have the provider that they've chosen at the crux of the relationship. Um, I think that's really what drives the ability to have sustainability in MA. I think being able to work with these providers that hold such trust with the members, they're the ones that understand the member health inside and out. They understand what it takes to deliver on the clinical outcomes. That becomes how you drive that product sustainability in a provider anchored member experience. And I think that will separate the plans that thrive from the ones that struggle.
Yeah, I mean, I think that is a little bit why Best Buy is in this space, is
Mm.
that personalization, that relationship piece. Um, I think, again, probably most people on the call, I would like to think, have heard of us, and that's a little bit because we're in your region, we're in your space. I think the statistic I always see is that close to 70% of the US population lives within the 10-mile radius of a Best Buy store. We're really the last kind of technology oriented retailer, but we are very present in communities. And then, of course, there's the Geek Squad piece, which are close to 10 million in home visits, really personalizing that delivery versus just possibly a box at your door, but an actual human that you're interacting with and installing the software. That speaks to a little bit how I think we have an expectation of healthcare, that it is not an impersonal online experience, that you have a provider that has your medical records, that you have a health plan that's looking for the gaps of your care and how to fill them. again, a little bit the point of
Mhm.
Medicare Advantage. Um, what are other things you're thinking about from an innovation standpoint? What directionally, where do you think you should go?
Yeah, I mean, I think that there isn't, a whole lot of new and, rocket science answer to that. It really is continuing on the path that we've been going, right? Which I would probably break into two categories around care delivery innovation, really that last mile piece, and the technology enablement of that. SCAN has actually invested quite a lot in care delivery since 2021. We had launched and acquired four care delivery assets. So we've got Welcome Health, which is our own primary care geriatric group. We have home-based medical, which actually wraps around the provider to make sure that they can serve patients outside of the four walls of a clinic. So whether that's chronic care, transitions of care, palliative care, et cetera, really to close those gaps. We have My Place, which is a PACE program, and Healthcare in Action, which is an integrated street medicine organization. And these weren't just mission aligned for us, it was really mission critical as we saw how seniors were aging and evolving in that journey, where their needs may be different, and how to do more than just what a health plan does. We can't just stand and say, like, we believe these things should happen. This was our way of making sure things were actually happening in that realm. So that it continues to be very exciting, especially as we think about the sustainability of Medicare Advantage and how we can rely on those care delivery assets to deliver on an integrated experience for our members. I think technology has obviously been a huge point. The ability to kind of have not just technology for the seniors and their caregivers to close the gap in communication and making sure that they have what they need to be more on top of their healthcare between member, caregiver, member, provider, member plan, but also the things that empower them to stay at home for longer because they are able to have a more close-knit ecosystem brought into the realm of their home through these devices. So I think that has been a huge game changer. And I think technology on the flip side internally of how do you use that to actually enable the stakeholders that are the most important pieces of the equation for healthcare, whether they are the providers or the brokers or your member experience agents, to really enable a personalization for the member experience whenever they show up.
Yeah, of course, I have to ask the other kind of question du jour du
Of
year
course.
is around AI and where do you feel AI kind of fits into that story?
Yeah, if I had a nickel for every time.
Yes,
Just
I felt I was obligated.
you and I
It-
both. Yeah, I think that we're really trying to make sure that we're not just hammer looking for a nail when it comes to these
yeah.
kind of innovations. We want to make sure that there's the right problem solution fit, and the common denominator is anywhere that there are complex workflows, the need for a seamless and personalized experience, and the need for better super boosts for our teams. Those are great use cases for AI. Sometimes it doesn't need crazy technology, it just needs a different way of working together, which I think AI has forced us to think about, whether that's a purposeful byproduct or not. But other times it allows us to implement new technologies like Cresta, which we're using to empower our member services teams, using that with our sales and pharmacy teams as well. And then also opportunities for us to actually evaluate opportunities to invest internally, where there is an opportunity to leverage our own analytics, proprietary data to build the right tools tailored to our needs, whether that's in clinical care or member experience or benefits navigation. So,
Yeah, I think that makes sense to me. I mean, I'm a practicing doc, and I always get the question about AI, and it's always framed as like this negative thing, like,
mhm,
am I terrified of AI? Is it going to take my job? And I'm like, it actually so far and how we manage it today and how we approach it is it makes the practice of medicine, I think, not just as a physician, but all across the line, much more powerful and much more personalized because it's able to cut all the data out there and essentially
mhm,
augment that care relationship. That's certainly our kind of approach to it within Best Buy today, which is an augmentation piece. And I think it's exciting. I do recognize that people are worried about being in the constant triage
yeah,
of phone calls. It's one of the reasons for our call center that supports our fall detection business.
mhm,
We're very sensitive that people particularly our seniors who are probably the most wary of AI,
Uh-huh.
are getting to a human as fast as humanly possible, no pun intended, to meet their needs, because I don't think AI is certainly there from a empathy and kind of the right level, that human centered touch that it sounds like both of our organizations focus on. So that's I love that. Yeah,
Yeah.
thank you. Um, so a little bit kind of future state, maybe a little bit of a tougher question, is where do you think we're going? What do you think Scan is going to invest in? Where do you see the opportunities?
Yeah, I mean, if I had a crystal ball, I would certainly use it right now. But I think we are doubling down on the things that really make us unique and what makes us serve our members better. Back to my provider partnerships point, we're really investing in identifying the providers to go deep in because we understand the value of the relationships they have with the patient. And I think that that opens a lot of really interesting doors when you're able to kind of cross the table chasm, when instead of negotiating against each other at the table and saying,
Yeah,
this is a really interesting time for us. This is a time where we should go back to our common denominator of we exist to serve seniors well. So knowing the same pressures that we're each facing from different directions, may that be market or policy related or just being able to make the operations work, how do we redesign it in a way that makes radical common sense? That's a phrase that we
yeah,
use all the time and test with each other. Does this actually make sense, right?
yeah,
At the end of the day, you have to go back to the realization that it's not just, I'm designing benefits over here and you're kind of contracting for rates over there. It's not supposed to be that abstract. It's become abstract by design, not by intention. We forget that it's about the 75-year-old Mr. Williams who's trying to manage his hip fracture so that he can go back to tossing a football with his grandchild, right? It's about Mrs. Taylor who wants to live at home until she's 95. Really bringing it back to the human side of things. And you can invest in a lot of technologies that are at the intersection of payer and provider workflows to make all that different and possible and way more efficient with the member in mind.
yeah. I think what we're all kind of focused on and working in particular in this space is there's just been a lot of action about shifting, and this is going to sound maybe like pejorative, but a little bit the onus of care a little bit away
Yeah,
from the provider. And it's obviously not unique to Medicare Advantage. In fact, I think Medicare Advantage, because of that supplemental benefit space where you can look for gaps and
right.
fill in those gaps and say, we think there's a particular need here, so we're going to offer that as a plan. But just in general, there's a little bit of what do people like, what sort of self-care do people want to have? What do they want to manage internally? And can you support them on that journey? And
Mhm.
I kind of opened up with talking a little bit about our fall detection piece, but of course, we do it as a consumer product as well, and people can buy it for their loved ones, they can buy it for
Mhm.
their spouse. It's a peace of mind piece. But we've seen this interest in growth in fall detection within the supplemental benefit space because, from an ROI perspective, if you can reduce
Yeah.
falls at a low cost, it seems a bit of a no-brainer. What else are you kind of seeing in that, let's call it kind of safety independence area?
That's an interesting question. I mean, ambient listening, we know that that's been around
Yeah,
for providers for a long time, but there's definitely an influx of tools to try to ambient gauge where the
yeah,
seniors' health are, right? So whether that's detection of falls or just biometrics in the home or in a senior living facility, there's definitely a lot there. I think there are also, we've gone through the Amazon Echo and the Google at home type of devices, seeing how that's also being tailored for seniors to connect them to community, loved ones, etc. Whether seniors are open and willing to embrace that yet, I think is definitely an adoption question, but the technology is certainly there to enable it. Um, I think there also are definitely opportunities for innovative clinical programs that are probably getting their feet wet through things like supplemental benefits, or even, just through clinical programs that are being piloted with health plans right now to demonstrate things like, if you can screen for Alzheimer's earlier, can you actually provide enough ROI through a dedicated program and caregiving support that it should become a supplemental benefit? Things around nutrition and, seniors are on GLP-1s too. Is there something necessary to support them in a different way so that they're still reaching their health goals while also helping them, wean off of GLP-1s in a safe way? So I think the same themes around nutrition, neurodegenerative diseases, managing chronic diseases, just doing it in a much more collaborative and personalized way for seniors, and seeing how they kind of get through each hurdle of a Medicare Advantage plan until it becomes something built into the plan design.
Yeah, I love that because I think that personalization piece, particularly how to orient a lot of this exciting technology towards seniors, is one of the most critical pieces. In other words, that just because it shows a benefit in a population doesn't mean that it will necessarily serve this one.
Hmm.
And then you have this kind of user interface piece. I mean, we just both discussed how having it human centered versus necessarily technology centered is particularly pertinent in the senior space. And I always like to throw in that some of like the sexiest technology, it's not even necessarily that it's not ready for prime time with seniors. It's that there's probably some low hanging fruit around low tech things. I mean, if you
Yes.
look at the growth of supplemental benefits, one of the biggest areas is bathroom safety,
Yes.
right? And that is not a cool ambient device, though I know we're all dying to have ambient devices in our bathrooms, but it's in fact just safety
Yeah.
and padding and grips
Yeah.
and assist devices.
So
So
I
I
think
think
like the way that there is definitely benefit to thinking about how you cohort these seniors, right? I
yeah,
think the biggest mistake that I think we've made previously, and I think this is across the industry, is just seniors are just this big group. And in reality, especially as the most recent cohort of MMA enrollees have been way more tech savvy than previous, the segmentation breaks out to be, those that have also been on their phones as much as we have been, and are looking for a digital first, tech first engagement from sales and enrollment and education of the plan options all the way through to when they're talking to their plan, versus those that may still reach for the phone first. And even when you do, how do you then say, where are the ones that are more looking for maintenance and longevity as their primary concern versus the ones that are really looking to solve a specific condition that is taking up more of their mind share than previous. So it has certainly been interesting to be able to more customly design for different populations.
yeah. I mean, we think a lot about that in our kind of offerings for the market, in the sense that while we still have the jitterbug phone, which many
Hmm.
people will remember, that is a flip phone and particularly designed in a tactile sense for less dexterity in the fingers, easy access to an emergency button, etc. We also have a smartphone. And while there is some added tech to make calling urgent response and some social care needs that seniors may have, at the end of the day, they still want a smartphone. They want smartphone
Right.
access. They want to be able to browse the internet. They want to text and do a lot of these things that I think we used to not characterize as kind of in the interest of seniors, as potentially we've done tech support for
Hmm.
our loved ones in that
Yeah.
regard. But in fact, there is that desire. Though on the flip side, and certainly as I kind of trend watch, the more it just works, the kind of that space I think is particularly exciting. I mean, I do feel like we have been on the edge of ambient technology supporting seniors for a long time. I thought with whether it was Google Home or Alexa
Mhm.
or Apple in the home, that there would be a fast follow of clinical support.
Mhm.
Obviously, on one end, providers drowning in data maybe are a little less excited to have,
Right.
Apple
More.
or Amazon or
Yeah.
Samsung reporting the
Yeah.
seniors under their care, daily activities. that's one piece of it. And then the second is just how do we make it work? How do we make it appropriate? We do tons of work in fall detection. And as we've looked at kind of the clinical space, which is, let's say, hospital at home versus the consumer space, the definition of fall is so different. If we took a
Right.
clinical fall and put it on a consumer fall, uh,
Hmm.
we would be alerting all the time. Anytime somebody would slump, that would be considered a
Right.
at-risk fall. So
A little
it's
different.
yeah, it's exciting to manage and a growth in this space. I love that we've kind of, if I'm looking at a trend of this conversation, it's the kind of humanization piece. Good that we're on topic, but
Yeah.
also the personalization. And I actually think that's a great euphemism in that humanization piece because
Hmm.
I think we have found the risk of technology and certainly healthcare in the United States, as it often is practiced for better or worse, for many reasons, historic reasons, um, it really is dehumanizing. And fee for service system in Medicare, for example. And I love that we have kind of revisited humanization as how to humanize healthcare is to
Hmm.
make it more personal. Can you talk a little bit about that as well?
Yeah. I mean, like thinking about the human touch, there's always ways that as a health plan we can do better with that because we are a few degrees removed, right? Whether
Yeah.
it is through the provider or through some other channel to typically reach our members. So we're always looking for ways to partner with people to amplify that human connection. I think at the most basic level, being able to understand what matters to a member, like, I mean, when you call a customer service line or when you go talk, like, what makes you feel valued?
Yeah. Well, I mean, start if they recognize my number. It's even the
Okay.
most basic
Yeah.
thing.
Yeah. And then like I'm sure that you've had good experiences, bad experiences where it's like, okay, they knew who I was. They remembered if I've called about this thing 10 times before. They hear me, so I hang up the call knowing either my problem has been heard and is on the path of being resolved or can be resolved. And if there's a question, I actually understand the why behind certain things and next steps.
Yeah.
Like it's all the basic things that we all expect when we call a line for anything from a restaurant reservation to an airline reservation. They're all very basic things. But I think that's where we're trying to just get the complexity of healthcare down to something super human. Um, and I think that, and then also understanding the caregiver piece of this, also making sure that they have what they need because they're also humans on this journey as well. I think this partnership with Best Buy has actually been a really interesting one in terms of understanding where the locus of trust lies within a community. Yes, providers are a big one, but we also understand that they have lives beyond their healthcare journey. And sometimes they look to what they see in their neighborhood, which is probably a Best Buy and a strip mall, to say, I go here for a lot of other things that I trust when I think about connectivity, when I think about accessibility, and when I think about things that allow me to live a digitally enhanced life. How can I use those things as I'm also getting older? And I think that that is a different entry point. Right. I think that it's super interesting that the Geek Squad does not just do things like set up your Wi-Fi and install your TV, and that it can actually be an entry point into other things that are more care delivery related. But I think those are all things to realize that considering seniors and members as humans is to realize that there's way more than just that one data point and transaction point when you're on that call or when you're enrolling them, to realizing everything else that's around them and really leveraging that and giving them a holistic experience.
Yeah, thank you. I mean, I think if this serves as also just a great advertisement on why Medicare Advantage, right? Why switched? No, I mean, I really believe it. And again, partially as a doc, the more that you can personalize care, humanize care, and a little bit that has to do with that you as a provider are
Hmm.
not just the only one supporting a patient, right? That you're in alignment with the health plan and kind of meeting their needs and that they are not just a number to the health plan,
Yeah.
they have a relationship. And I think that is why if I look across the Best Buy health business, we love Medicare Advantage because it aligns with where we want to go philosophically, which is, in other words, enable the person to be at home, to age there independently, to feel
Mhm.
supported, and innovate within that. In other words, constantly be looking for the gaps and saying, okay, we fill the fall detection need today, but tomorrow we need to do more within bathroom safety. We need to do more in just general smart home technology. And I think that alignment between our organizations has been kind of a mark of success. And again, I encourage everybody to kind of look at those opportunities, both as a consumer looking at health plans, but also as someone interested in innovating and also caring for your loved ones, because I think the other piece of this, which we haven't really touched on, but is obviously important, is that many of us are potentially in a bridge gap in supporting as a caregiver
Mhm.
seniors in our community and our lives. And we're very interested in making that easier. You as a plan to, to create a caregiver experience to kind of reduce risk around your members. And of course, as Best Buy, we want to be a trusted member of the community. And sometimes technology is hard, so it is
Yeah.
helpful to have a loved one, slightly younger loved one potentially.
Yeah. I mean, I'm not sure whether it's really commonly or as commonly known how far Best Buy Health's reach is with seniors.
Yeah.
Could you
Yeah, I
share
mean,
a little
again,
bit?
back to
Yeah.
as I started it out, we're not just hanging TVs, which
Yeah.
is actually have 1 million consumer and plan members out there using our fall detection devices. And that is not to speak of people buying blood pressure cuffs, using Geek Squad to ensure that their Wi-Fi is running in their home and supporting, let's say, their ambient healthcare technology in Tennessee and other states around the country. So yeah, we are kind of deeply involved in this, but again, for the reasons you laid out, which is that this is a great opportunity for us as a trusted technology partner in every community in the United States, really support this care journey. And of course, we love doing it with you all. So thank you.
Awesome.
I think we are actually at time. So again, appreciate everyone tuning in. Um, you can tell we are both excited about the opportunity of technology and innovation in the healthcare space and humanization of healthcare. I think it's really, really important. So any questions certainly can get to us, and we'd love to answer them.
Thank you both so much. That is all the time we have for our webinar today. But Rona, Dr. Zaniello, I just want to say thank you truly for sharing this time and insight with us. What an excellent conversation we just got to experience. Thank you as well to Best Buy Health for sponsoring today's webinar. Attendees, we appreciate you spending some time with us today, and we hope everyone has a wonderful rest of their day.